Do you have problems with sleep? Trouble falling asleep? Maybe you can fall asleep okay, you have trouble staying asleep. Maybe you have problems with both. Maybe you are like tired during the day and awake at night. There's lots of different ways that sleep dysfunction and sleep disorders can manifest. One of the things that's common in my practice, and I know in that of so many other practitioners, is that with chronic illness and chronic pain, sleep problems are fairly ubiquitous. It's more surprising to me when I'm talking to someone with a chronic illness and they have good sleep, normal sleep. That's kind of the abnormal. So, I want to talk today about a couple of things that are really important to setting yourself up for success with having sleep problems. These things will help. I doubt that they will completely resolve the issue if you have chronic illness. There's a lot of things that can play in. I'll go into some details of some other things that are supportive in some other videos, but this video is about really laying a couple of foundational pieces. So the first thing that I want to talk about is your bedroom or wherever you sleep. What is that environment like? Is it clean? Is it messy? Are there clothes all over the floor? Do you use your bedroom for other purposes? You have a desk in there and you sit and do work in there as well. Um, I highly recommend that you only have your bedroom be for the purpose of sleeping, and importantly, setting it up as a sanctuary space. It is a sanctuary for rest and rejuvenation. When you go into your bedroom, your body, your nervous system just, it should go into the mode of sleep, essentially. So, one of the things that is common is that people have a TV in their bedroom. I really recommend not doing this. If that's not an option to take the TV out, have a tapestry or something that you can put over the TV. Keep that energy out. It is a fairly intrusive energy, even not having the TV on, to have a TV in the bedroom. It kind of takes a lot of attention towards itself, and that's not where the attention needs to be in your room. So, if you can take the TV out, I really recommend against watching TV to fall asleep. I recommend no screens at least a half an hour, if not an hour before bed, which I'll get to in a minute. But I know a lot of people like to fall asleep with the TV on, and usually it's because people say kind of like there's like the background noise thing. You don't need the TV for that. You can get a white noise maker. I've been used to one for a couple of years now because I have a 2-year-old son. We've used one of those since he was a little baby. You can go on any like music app that you have, like Spotify or whatever it might be, or probably just like YouTube, and search for pink noise. That will help you get into a brain mode for sleep. So create your bedroom as a space that just feels inviting to you and relaxing, okay? Reflect on what that looks like for you. The other thing is having a routine and ritual before bedtime. This can be all kinds of different things, but essentially doing the same thing every single night. The brain, the nervous system really likes patterns, structure. Your body will get used to that ritual quickly, and it will start to just signal like, okay, it's time to start transitioning to that mode of sleep, okay? So if you're not doing this consistently, start at least 30 minutes, if not an hour before you go to sleep. Have something relaxing that you do. Screens go away. Maybe you play some calm music. Maybe you like to read fiction. Have a cup of tea. I'll talk about some herbs in a later video. Whatever it might be for you, maybe you play your guitar or your piano or something, just something that's calming to you, transitions you into the mode where it's like, okay, now I'm going to be going to sleep. And do it the same way every single night. So you're practicing a ritual or multiple rituals, routine, and then you're going into a space where it just feels like you just want to sink down into the clouds, okay? You just want to feel cradled and held. This is important. All of the other things that we can talk about that help with sleep really need to build on top of this. You have to set the environment up for success. So that's my piece for today. And I'll see you again for the next video soon. And I will talk about some nice nervine herbs that can be helpful for sleep. I'll also have some videos on cortisol dysregulation and how to start bringing that back into balance. Lastly, go to bed at a reasonable time. I'll touch on this later, but at least by 11 o'clock maybe, not like 2, okay? You have to start teaching your body, this is when I go to bed, even if you're not tired right now. So reflect on those things, take some time to start practicing that, and I'll talk soon.